I think if you have a healthy woman and a healthy pregnant woman, you should recommend strength training because it's really important, as we know, for pre, peri, and postnatal health, not only for the baby, also for the woman herself.
Hi, Katja. It's my pleasure to have you on Evidence Strong Show. If you could briefly introduce yourself.
Hello, nice to meet you. I'm Katja. I'm from Austria, Lower Austria, living near Vienna, and I'm a physiotherapist. In June 2023, I did my bachelor's degree at IMC Fachhochschule Krems in Lower Austria, and since August 2023, I'm working as a physiotherapist at Universitätsklinikum Hochegg in Lower Austria with neurological patients. Since 2 weeks, I also finished my training as a sports physiotherapist. And I wrote in my bachelor's degree, I wrote about strength training in pregnancy, especially in the third trimester.
Awesome. That's the topic of our conversation today. And let's start with the third trimester.
Yes, in the third trimester, it's between weeks 29 and 40. There are a lot of physical changes that occur. The muscular skeletal changes include increased lumbar lordosis and a loosening of the ligamentous structures, particularly in the pelvis, the sacroiliac joints, the pubic symphysis, and this leads to a change in posture and thus to a new sense of balance.
The third trimester seems to be very impactful on the health of a woman. She's growing a baby. The baby is big by then, and it changes how the body functions. So, what do we know so far in terms of strength training in pregnancy?
It's difficult because I researched a lot and there is not much you can find in the web, because I think people don't talk about strength training in pregnancy because you shouldn't do that and so on. But strength training during pregnancy offers many benefits, such as improving core and pelvic floor muscles, relieving back pain, stabilizing joints, demonstrating positive effects on blood pressure and blood sugar, facilitating labor, and promoting faster postnatal recovery. Previous studies show that moderate controlled strength training, for example, 2 to 4 times per week for 30 to 45 minutes at 50 to 60% intensity, can be safe until shortly before delivery. And of course, there are also contraindications such as bleeding, premature birth, cervical insufficiency, strong intra-abdominal pressure, for example, from deadlifts or the leg press, as well as supine exercises in the late stages.
What was your study about? So, what were you trying to find out?
The aim of my study was to determine whether and to what extent healthcare experts recommend strength training in the third trimester, then to identify the health benefits pre, peri, and postpartum, and to identify risks and formulate concrete recommendations for safe implementation for coaches, physiotherapists, gynecologists, and so on.
How did you design your study?
The chosen method was qualitative research with structured guided interviews. I transcribed the interview content using Meiring's content analysis, paraphrased it, and divided it into 4 thematic areas: the advantages and disadvantages, the professional experiences, and the public perspective and personal recommendations of the interviews. I invited 5 experts, including a midwife, a gynecologist, a sports scientist, and 2 physiotherapists. And the inclusion criteria were active professional practice, regular work with 10 or more pregnant women per year, and the experience in prenatal and postnatal care.
Awesome. So you interviewed 5 health professionals who actually work with pregnant women and women who are in postpartum, so just after delivery. Then you try to come up or qualify the answers into 4 buckets.
Yeah.
So could we go again through the buckets? Advantages and disadvantages of strength training during third trimester. The next one was?
The next was the professional experiences of the experts, then the public perspective and the personal recommendations of the experts. I was a little bit shocked because the gynecologist was the one that was the most scared of strength training in the pregnancy, and the physiotherapists were they do and they train and they run and they love doing sports in pregnancy.
All right, so let's go through all 4 buckets. So what did you find in each of the 4 categories of 4 fields of your data?
Yeah, all the experts recommended controlled strength training even in the third trimester, provided it is of high quality and individually tailored. Prenatally, strength training offers improved body awareness, prevention of diastasis recti, reduction of back pain and water retention, and maintenance of stability despite ligament loosening. During labor, they called benefits like increased strength and endurance for labor, and the ability to change positions more quickly. And postnatally, they think strength training during pregnancy leads to a faster recovery from labor and improved pelvic floor and core function. The risks of strength training were overloading, incorrect technique and breathing patterns, excessive intra-abdominal pressure, and premature labor or bleeding. So that were the advantages and disadvantages of the experts. The experiences were, as I told before, that gynecologist was a little bit scared about strength training in the third trimester, but
Did they say why? What they were scared of?
not really. She always called the risks, but she never said don't do it. Yeah, but I think she's a little bit scared of training in late pregnancy. All the other experts were really thought good about strength training, even in week 40 of pregnancy. Yeah. Then the public perspective is, as we all know, most people think, not all, but most people think when you're pregnant, you have to lie in the bed and don't do training, don't do sports, not much, only walk slowly, don't carry your bags. I think the public doesn't know how much your body can do in pregnancy. Yeah. And you don't have to be scared about lifting weights because, for example, you have a 5-year-old child and it comes to you and you are pregnant and you take it, and that's also weight. Yeah, that's also training.
Yes.
I think many pregnant women forget about that.
I think also if you will lie down for 9 months, it will be very hard to then function normally after the baby comes. So you mentioned there was one of the categories was personal experiences. Could you say a little bit more about that? What did have professionals said in this category?
Yeah, the physiotherapists especially work with pregnant women or women that just had the delivery. So they go through a lot of women that don't want to train. They are scared of training, but they always do strength training with them because they think the labor can be so much better. You have so much more endurance and strength for the delivery, and after that you have so much endurance and strength for raising the little baby. The midwife makes courses for more than, it were about 10 women to prepare for the delivery, and there they do breathing techniques, training of the the muscles in the abdominal area. Yeah, and the sports scientist does the same, like the midwife. The gynecologist, she doesn't do training with pregnant women.
So she just cares more medically, checking whether the baby is growing and so on.
She told that she has patients that train in pregnancy, but she doesn't say, okay, you have to do this and only lift 5 kilograms or so. She just does the medical examinations.
Interesting. Okay, so it seems from what you said that the health professionals who do work, so they actually work with pregnant women and their main work is to prepare them for delivery physically. These specialists will recommend strength training and then they will be involved in the process and advise on how the client woman should be or could be training. Whether the gynecologist, the doctor will mainly focus on medical checkups and the medical side of running the pregnancy. They were not involved in the training or physical preparation of the mother.
Yeah, that's true. Yeah. The main message was that strength training is safe, beneficial, and should be recommended to support pre, peri, and postnatal health when the strength training is correctly adapted to the individual and taking into account medical contraindications.
What do you think should be the main message from your study?
I think you should try do sports, do strength training in late pregnancy if you have done it before. Yeah. Don't start with training in late pregnancy, do it since the beginning or before pregnancy. And I think it's important to go to your medical examinations, check-ups.
Would you have any advice for coaches who either want to work or are working with pregnant women, or they have clients who are about to get pregnant or just got pregnant? What would be your advice?
My recommendations are to consider previous athletic experience. Beginners should be introduced to train slowly. The focus should be on full body and strength endurance training performed twice a week at moderate intensity. Of course, when you always trained harder, when you have always trained harder, you can do that hard training as well in pregnancy. Yeah, the supporting muscles of the torso, the pelvic floor, the back, and the oblique abdominal muscles are particularly important. Exercises that place strong pressure on the abdomen or are performed while lying on your back should be avoided. And of course, the subjective feelings of the pregnant woman should always be taken into account. Training must be discontinued or adjusted if any discomfort occurs. And you have to do your medical checkups, of course.
I just wanted to add one thing. I had Christina Prevet on this podcast a few weeks ago, and she researched athletes who do a Valsalva maneuver in late pregnancy, and she found, this is of course association study, this was not randomized controlled trial, but she found that there is no negative correlation between outcomes for mother or for baby when using Valsalva maneuver with 80% of the weight. So it seems like, in science we go slowly, especially during pregnancy. The safety of the mother, the baby is at the forefront. So this was just retrospective association study, but there are slowly coming up randomized control trials, and it looks like strength training is in healthy pregnancy is pretty safe. And the athletes who were training strength training before pregnancy are continuing with good results through pregnancy, even to the third trimester, and then picking up strength training pretty early after. So these things are changing constantly. So studies like yours are very important, so we can monitor what is safe and what works, and also how it then trickles into clinical practice. Because your study shows that gynecologists this one in your study was pretty scared and risk averse and was on the safe side, which was, I'm not telling you not to do it, but I have some reservations. Physiotherapists who work with pregnant athletes or pregnant lifters, or they are more experienced, and therefore the risks for them are a little bit different, or I don't want to say less, because if there are some contraindications, I'm pretty sure that would be taken into account, but they have bigger knowledge and bigger experience to advise.
Yeah. And I also think the physiotherapists, they know about training, they know about weight training, and the gynecologists don't have this know-how. So it's it's not easy for them to do any recommendations.
But what do you think? Maybe that would be the way the gynecologist focus on finding and assessing the risks and assessing the medical side, and are very vocal if there are contraindications. But if it's a healthy pregnancy and there are no problems, especially when a woman had experience in strength training before getting pregnant, that should be under care of other health professional like physiotherapist, like midwife, like food scientist.
Yeah, I think if you have a healthy woman and a healthy pregnant woman, you should recommend strength training, because it's really important, as we know, for pre, peri, and postnatal health, not only for the baby, also for the woman herself. Yeah. So let's come and train.
I agree. Okay, 2 short questions to finish. The first one is, what is your favorite exercise? You personally?
I think deadlifts.
Whoa, really?
Yeah, I love them because you have the whole body, not only the legs, the back, the grip strength, and it's so cool. You can do it with children, you can do it with grandmother and grandfathers. So cool.
All right, and the last question is, if someone wants to follow your research or ask a question, where should they go online?
I'm not that active online, but I have a private Instagram page called Katja Ungersböck. Yeah, you can follow me there and write your questions. And if you want, I can send you my study.
Thank you so much, Katja. It was a pleasure.
Thank you too.